Today's topic is BPH, which stands for benign prostatic hyperplasia and is more simply known as having an enlarged prostate. The prostate is a reproductive organ that sits below the bladder and contains the first part of the urethra, and this is the tube that carries urine out of the body. As men age, the prostate grows and can compress the urethra, making it more difficult to fully empty the bladder. This can result in a weak stream for men, and they may even dribble after they're done urinating, sometimes straining to empty. If they fail to empty completely, they may have to urinate more often, which can be especially bothersome at night and disruptive to sleep. Medication may be used to relax or even shrink the prostate. However, this may not be adequate to control symptoms, and a prostate procedure may be considered. Choosing a prostate procedure involves considering many things, including the size of the prostate. It may be helpful to think of the prostate like an orange, with an outer shell or capsule and inner lobes of tissue. A common procedure, known as TURP or TURP, is similar to going through the center of the orange and creating a wider channel from the inside. Using a scope placed in the urethra, strips of prostate tissue are carefully removed and then evacuated from the body through the scope, with electrocautery used to seal blood vessels along the way. In some cases, a surgeon may instead use a laser to vaporize tissue rather than removing individual portions. Men often ask what's new regarding alternatives to TURP that may be faster, have a simpler recovery, and a better chance of preserving ejaculation. One such example is Rezum. This involves injecting water vapor into the prostate tissue. Each injection takes only 9 seconds, and most procedures involve between 2 and 4 injections. Patients go home immediately afterwards, and the prostate regresses in size over the next few months. Another option is called Optilume. This involves a drug-coated balloon that's inflated to widen the space between the two halves of the prostate. Total procedure time is less than 20 minutes, and patients return home the same day. As with all procedures discussed, patients typically go home with a temporary catheter. One novel technique is known as Aquablation. In this scenario, a water jet is used to destroy tissue, and the procedure involves computer guidance. Another of the minimally invasive options is known as Urolift. This procedure essentially involves stapling the prostate open in order to improve urine flow. Going back to the concept of larger prostates, in some cases, more tissue removal may be desired. A traditional option for this is known as simple prostatectomy. Using the example of the orange, this would involve going in from the outside and extracting the inner portion of the prostate. In the past, this was done with open surgery and involved an abdominal incision and manually removing the obstructing center of the prostate. Now, however, this can be accomplished in a minimally invasive approach using a surgical robot. However, it's important to recognize that large glands can also be treated without entering the abdomen at all. In a procedure known as Holep, a laser fiber is used to shell out the inner prostate tissue. This tissue can then be digested and extracted through the scope. We recognize the importance of seeing our patients as individuals, and this requires informed decision-making and personalized care. Here in Men's Health, we find joy in helping men go from something like this to something like this. We look forward to serving you.